All right, hello everyone. I'm Beth Longmire. I'm a third-year resident in family medicine in Houston, Texas. The third year is the last year, for those of you who don't know. So I'm starting to see the light at the end of the tunnel. And I'll just say that each year from here on out gets harder, but it also gets better. So you do have something to look forward to. And I know that we were just talking about applications a lot. And I'll say that the languages that I speak French and Spanish, and I've also studied some sign language, have come up in all the interviews that I've done. I also have interviewed people entering into medical school and into residency, and we start to talk to them about languages and their experiences they've had. I was interviewing today for a fellowship position here and was asked about the languages I speak, and then got into a long discussion with my interviewer about speaking Spanish with patients. And those questions are a lot easier to field than the other ones about where do you see yourself in 10 years? So just a little bit about where I learned my language. I was born and raised in Madison. My mother is a French professor. And I started studying French in middle school, studied it all the way through high school and college, and did a semester of study abroad when I was in high school, and then another summer while I was in medical school. For my Spanish, I took a semester when I was in high school, and then 2 semesters in college. I took the intensive course over the summer. I do highly recommend taking classes that way. It's a good use of your summer, and you get through a lot of language quickly. I've also done a lot of self-study and did a month, as Wendy mentioned, in Costa Rica this past summer. So just a little bit about where I am. I'm in Houston, Texas. It's the largest medical center in the world. Our hospital is just outside of the main medical center complex. That's the hospital there. It's the second busiest ER in the area. And about half the patients that we see speak Spanish and have such limited English that we have to speak Spanish with them. And typically my day depends on the rotation that I'm on, but if we're working in the hospital, we get there about 7, round on patients, then run through them with our attending doctors, and then spend the rest of the day checking up on things, making sure the patients are getting the care they need, doing procedures, and admitting new patients to the hospital. This is my clinic. It's beautiful. It's a lot of fun to work in, and what I like about it is that we see patients with insurance, with no insurance, with Medicare, Medicaid, and all patients are treated the same. We also see patients who speak English, don't speak English, and again, we treat them the same. It's not one pretty clinic for patients who have money and another one that's not as nice for those who don't. These are the languages that I could remember that I've seen patients who speak these languages. We have a pretty big mix, especially down in Houston. We have a lot of, it's a very diverse city, and then there are a lot of international people coming to live there, study there, and refugees. These are the languages that are spoken at our clinic. I showed you the photo of that, by the physicians and the staff. We don't necessarily use all of them with our patients, but we do speak them all, and we keep a list so that when patients call in to make an appointment, they know what doctor to go to. And this is something that our clinic keeps in mind when hiring new physicians is, will you fill a need? We needed someone who spoke Mandarin, and so when we were looking at a new physician, the one who spoke Mandarin won out over one who didn't. So I just thought I would tell you a few stories of things I've gone through with language during my residency. During the intern year, we worked at the inner city county hospital, where about 90% of the patients speak Spanish and speak Spanish only. I was working in the OB area where patients come in and they think they might be in labor, or they're pregnant and they're bleeding, or there's something else that is fairly emergent happening. It's a very, very busy hospital, and you don't have time to sit around and wait a half hour for the interpreter to come up or to find someone else there who speaks Spanish to talk to the patients. It's up to you to get it done and get it done now. You have about 5 minutes to get that history. And so with the basic Spanish I knew and the French, I learned pretty quickly how to ask, how many babies have you had? How far along are you? And go through the basic questions that I would need to be able to say to get through the medical history correctly. And it was interesting when I handed off to the next resident coming, I gave her a whole cheat sheet of these are how to say all the sentences you're going to need to say. Then when I came back to the regular hospital, the only thing I could really say in Spanish was stuff about pregnancy. But I learned more. This is an actual x-ray of one of my patients. I know you guys are early in your education, so don't feel like you need to be able to read this. The small x-ray is what a normal chest x-ray should look like. So you probably noticed that on this x-ray, this black area, which represents air, is the lung, is a lot smaller than it is here. And also that there really isn't very much on this side. And this patient, there's really no lung on this side. Also, the trachea, this black line coming down the middle where you see the airfield, is bent over to this side, and the heart is shifted to this side. This patient came in with a chronic cough. She was originally from the Congo, but then had ended up here in Houston as a refugee. She spoke French and Swahili. And she and her husband, who spoke mostly French and some Swahili, came in with a Swahili to English interpreter. But I was able to speak to them in French, which was nice because I could speak more directly to the patient and I didn't have to go through the interpreter, and explain to them what had happened to this patient. Anyone have any guesses? That's okay. She had tuberculosis and had become so scarred down on her left lung that basically it did not function anymore, and her entire chest shifted to that side to make room for the air on the right side. I was able to explain to them directly that she would probably never get better. It's difficult when you're giving bad news, and it's a lot nicer if you can do it directly with the patient rather than having to go through an intermediary. Another time that I've used my French, obviously French is not as common to use in medicine as Spanish is, especially in Houston, but was when I was going through the ER on my way to see a Spanish-speaking patient, and one of the nurses jokingly said to me, "Hey, do you speak French?" And I said, "Yes, I do." He's like, "Really?" I was just kidding. But it turned out they had a patient there who spoke French. She was, the patient was a man from Haiti, and he was there with his daughter because he was having leg pain. So they just wanted me to go in briefly and say, "You are having this leg pain because of the medication you're taking." He was taking a statin. He'd been started on it about a month ago. They knew that because they looked at the pill bottle that he had, and it was dated about a month ago. They weren't able to talk to him at all, and most of it was just miming. They talked about using the language line and calling up, but no one really likes to do that, and they wanted to get things moving because out in the real world, it's all about speed and getting things through. It would be nice to use professional interpreters appropriately, but that's really not how things end up happening, especially when there are budgetary constraints. So I went in and explained what the doctor who had been seeing her said, and was told that he had never started taking this medication, and he hadn't been having this pain just over the past month. This had been going on for 2 years and was getting worse, and he was starting to have neurologic symptoms. So just in a couple of minutes, I was able to get some information, pass it on to the doctors who were taking care of them, and then, well, I had to go see my patient, so they ended up using the language line. But it was really nice to be able to be there and do that for the patient so that they would get the appropriate care. So I mentioned the language line a couple times. In case any of you don't know what that is, it's a phone service that hospitals can subscribe to. You call in on a telephone and then put in your code that you're paying for this, and then tell them what language you need, and they'll get an interpreter on the phone. It's awkward and clunky and not nearly as nice as having a real interpreter in the room or just being able to speak the language yourself. So just learn the language. But when it goes well, you have 2 cordless phones, and the patient holds one and you hold one, you talk, and the interpreter interprets over the phone. When it doesn't go well, you only have 1 phone and you have to pass it back and forth, and you're trying to guess when you're done with things and go through. I've used the language line when I had a baby came in, her mother only spoke Russian and was able to use the language line with it. I don't speak any Russian and I don't know what she was saying in Russian, but having studied other languages, I felt that it was just easier for me to be involved in the patient interaction, easier to develop a rapport and understand both the language struggle she must be going through with communicating and how scary that must be to be at a hospital and not speak the language, not understand what's going on, and the cultural aspects involved with someone who hadn't come up through this system. We also had a time where we had to use the language line on a patient, and we didn't know what she was speaking. We had no idea at all. We knew that she was from Africa, and I think it was some of my colleagues who actually saw her. I think they knew what country she came from. But basically, they called the language line and asked for someone who spoke as many African languages as possible. And they got someone on the phone who listened to her speak and said, "Well, I don't speak that, but I know what it is." And we're able to get the interpreter. But it took 2 hours to wait until that interpreter was free. another reason to learn the language, but obviously you can't learn all the very, very small languages.